John Mahoney, who is CEO of the American Red Cross of San Diego and Imperial counties, and Jim Floros, CEO of the San Diego Food Bank. There is something this afternoon that's very important that I want every San Diegan to know as we are going through this COVID-19 pandemic, especially San Diegans that are looking for ways to volunteer and to help out. Although we have the social distance and physical limitation, it's still very important that we lend a helping hand to our neighbors and those other San Diegans that need that. This is a time, of course, when our daily lives have been upended. But there is one thing that really never ceases to amaze me, and that is our city's compassionate spirit. My office has been working with our city employees and others across the city to help capture that spirit with relief plans for residents and small businesses who are facing financial hardship. But our work at City Hall is really just a small part of that action that our greater community is taking. We have received countless calls and emails from San Diegans with one simple question: how can I help? This afternoon, we want to take a few minutes really to tell you how you can do that. There are two critical needs in our community this afternoon that we are asking San Diegans to help with today. We need blood donations, and we need help distributing food. Across the nation, more than 2,700 blood drives have been canceled due to the COVID-19 pandemic. An adequate blood supply, as I think all of us know, is absolutely critical to our healthcare system throughout the country and, of course, right here in San Diego. It impacts surgery patients, car accident victims, and anyone who is suffering from an emergency. We cannot forget about that need during this public health crisis. One donation of blood can help save up to 3 lives. The Red Cross has put some additional precautions in place to protect the safety of all the donors and staff. So we encourage all San Diegans to give if they are healthy and can do that. In fact, this morning, Councilmember Moreno and I visited the Red Cross in Kearny Mesa. I was very happy to be able to donate myself. The staff was accommodating, friendly, and great. And it was great to see so many of my fellow San Diegans that were out there helping today. Sean, it was really represented the best of our city. So I'm going to invite Sean to tell you a little bit more about the blood need, how you can help in just a second. As I mentioned earlier, our second priority is food distribution and assistance throughout the entire city. This is going to be an increased need in the coming days and the coming weeks. We are proud to have the San Diego Food Bank here with us today to clearly say a couple of things. The food bank is open, they are accepting donations, and they are taking extra precautions, and they need people to drop off food items. Just a few minutes, I'm going to ask Jim to come up, our CEO of the food bank. So whether it's donating blood, whether it's giving your time to help donate food or deliver meals, picking up groceries for an elderly neighbor, or supporting a nonprofit, we know that San Diegans need to rise to the occasion, and they're doing so in increasing numbers. Blood and food assistance are just two of the ways to help. My office has been busy collecting a short list of other critical needs and organizations in need. So as you get that question, what can I do to help? You can find them online at sandiego.gov/coronavirus, and you can also visit 211sandiego.org to find more opportunities, a list of everything that you can do to help your fellow San Diegans during this time of need. Before I hand it over to Councilmember Moreno, I want to update on a couple of two different opportunities as well, two different issues. Many San Diegans, including members of my team, spent the day packing meals for local families and students in conjunction with the San Diego Unified School District. I want to thank them. I want to thank our entire city team and the volunteers that were out there throughout, really helping with this crisis, really helping our school district coming together. Another update is I had earlier today is a call with Baja California. I, along with many of our regional leaders, spoke with Dr. Perez Rico, the Secretary of Public Health at the state of Baja. It was a productive call, and I urged very strongly, in no uncertain terms, for the state of Baja to implement the very same health directives that we are doing in San Diego County. To close bars and nightclubs, to move restaurants to takeout or delivery only, and to strictly limit the public gatherings. In essence, we want to have one set of guidelines, if we can, for both Tijuana, for San Diego County. It makes all the sense in the world. So it was a real opportunity for me, as I said, along with some of our other regional leaders, to relay that message. These actions that we're taking are essential to slow the spread of the virus. And these are things that we should be doing as a united border region. We are one mega region. We have the largest border crossings in the world. And it's important that we all act together and in unison to help us get through this. I think my comments and others were very well received. The doctor assured us that he's going to be taking these recommendations to Baja Governor Jaime Bonilla for his immediate considerations. As I said, they've been taking many, many steps. And my very clear message was, can we have the exact same protocols? I think that will serve our region well. I particularly want to thank the Consul General of Mexico, the United States, Carlos Gutierrez, for arranging this discussion. Once again, it shows how our binational region can come together and work very, very quickly. We are proud of that relationship. We are proud of how integrated we are. And it was really an opportunity for health professionals on both sides of the border to share this information, and local officials as well. We are united in this. We are united in San Diego. We are united as a border region. And with that, I'd like to turn it over to Councilmember Vivian Moreno to give a few comments, and then we're going to hear from these gentlemen here on volunteer opportunities that San Diegans can do to help right now in terms of blood and in terms of food donations. Councilmember Moreno.
Thank you, Mayor. And I, too, encourage all San Diegans to be safe and practicing social distance. Obviously, this means avoiding groups and staying 6 feet away from other people, as we are here today. I encourage everybody to keep on washing their hands regularly. And one of the things that I want to really strongly emphasize, that we need to be washing our hands for 20 seconds. And that really what that means is singing happy birthday 2 times. For those of you who are healthy, please consider, as the mayor mentioned, giving blood at the Red Cross or volunteering or donating to the San Diego Food Bank. And we're all in this together, so we all need to be doing our part. Le pido a la comunidad de San Diego que para permanecer saludables se debe practicar el aislamiento social. Esto significa evitar de participar en grupos y tratar de permanecer 6 pies de distancia de todas las personas. Por favor, lávense las manos regularmente, eviten tocarse la cara sin antes de lavarse las manos. Una cosa que quiero enfocarme es que cuando se laven las manos, que se laven las manos por 20 segundos con agua y con jabón. Una forma de asegurar que se estaban lavando las manos por 20 segundos es cantar la canción Happy Birthday, el Happy Birthday, para que todos tomen esa precaución. También para la gente que se siente saludable, por favor, consideren donar sangre a la Cruz Roja o trabajar como voluntario en el programa asistente alimentario de emergencia. Juntos podemos superar esta amenaza. Y lo tenemos que hacer juntos. Así que aquí estamos como sus líderes de la ciudad de San Diego. Muchas gracias.
Thank you, Councilmember. Thank you, Councilmember. And again, thank you for joining us earlier today at the Red Cross. And speaking of the Red Cross, I'd like to invite up Sean Mahoney. Sean?
Thank you, Mayor, and thank you, Councilmember Moreno, for being there this morning to support the Red Cross and to donate. The American Red Cross is experiencing a severe blood shortage as a result of the pandemic. To date, more than 4,500 of our blood drives have been canceled across the country, resulting in 150,000 fewer blood donations. That's 150,000 fewer. Here in Southern California, we've had more than 285 drives canceled due to COVID-19 concerns, resulting in nearly 10,000 uncollected blood donations. We expect the number of cancellations to continue to increase, and this situation is unprecedented, and patients need the community's help, as the mayor said. Rest assured, we're keeping it safe for the staff and the donors at blood drives and donation centers. Donating is a safe process. The Red Cross has implemented new measures to ensure blood drives and donations centers are even safer for our donors and staff. Like a hospital, a grocery store, or pharmacy, a blood drive is essential to ensuring the health of the community. The Red Cross will continue to collect blood products during this challenging time to meet patient needs, including those in the many San Diego hospitals that we serve. Accident, trauma victims, and cancer patients rely on the generosity of blood donors in our community. If you're healthy and feeling well, please make an appointment to donate as soon as possible. Having an appointment helps the process, and they can be made at redcrossblood.org or by calling 1-800-RED-CROSS. Thank you.
Thank you, Sean. Thank you, Sean. And last up, I'd like to welcome CEO of the San Diego Food Bank, Jim Floros, to talk about their operations right now and how San Diegans can help the food bank. Jim, thank you.
Good afternoon, Mayor Faulconer and Councilmember Moreno. The main message today is that Jacobs & Cushman San Diego Food Bank is open for business. So are our 200 distribution sites, and so are our 500 nonprofit partners that we partner with throughout the year who have feeding programs. All programs will remain open during the crisis. There's plenty of food to go around, and we will make sure that that amount of food is distributed throughout the community. Before the crisis, we estimated about 1 in 7 people in San Diego County, about 450,000 people were food insecure. The San Diego Food Bank and our North County Food Bank chapter was feeding about 350,000 people a month. So the system is there, the infrastructure is there, the supply chain is there. All we need to do is ensure that we increase the amount of product to get it out to those distribution sites so people in need, and we know the lines are growing, that the people in need get the food they need to be able to survive. So again, 200 monthly sites will remain open. Our 500 nonprofit partners are continuing their important work, making sure they're distributing food. If people need food, they can call 211, log on to 211sandiego.org, or call the San Diego Food Bank at 866-350-FOOD. That's 866-350-FOOD. We have a major senior program, and we provide food boxes to about 13,000 seniors each month. Those 65 sites will remain open. Seniors can send a proxy to pick up their food if that's what works best for them. We've had a huge amount of volunteer cancellations just in the last week. About 50 groups representing about 1,400 volunteers have canceled. Our volunteers typically will have about 29,000 volunteer visits a year. Those volunteers are an integral part of our supply chain. So we're asking San Diegans to support the local food bank and help volunteer. They go online, sandiegofoodbank.org, all the information is there. If you see the shifts are open, please check back because we have cancellations every day. We also need financial contributions, obviously, because we're ramping up what we do and we're buying a lot of food to make sure that we have food to distribute in the community. We've put forth some measures to provide extra safety at those distribution sites. We've begun touchless distribution, so people don't have to touch anything. We're obviously doing social spacing, and again, the seniors can send a proxy to pick up the food product on their behalf. At the warehouse, we're doing those same measures. All volunteers are wearing gloves. We're doing social spacing, hand sanitizer, washing stations, and the like to make sure that volunteers are safe when they come in and help with our supply chain. And of course, we're telling volunteers, if you're sick, stay home. We'll love you, but we're going to love you from afar. And obviously, we're continuing to monitor the CDC and local health authorities to make sure that we're complying and we're up to date on how this story unfolds. So again, the Jacobs & Cushman San Diego Food Bank, we're open for business, and there's plenty of food. Thank you.
Thank you all. That's the highlight of today's briefing, and we're happy to answer any questions on any of the topics we've covered today or any other topic from members of the media. Thank you. Oh, one, go ahead. Yeah.
Actually, I got two. For the Red Cross, I know you mentioned some safety protocols that were put in place because of the coronavirus. Could you kind of run through that for us?
Sean.
Absolutely. So we're screening both our staff and also the volunteer donors who come to the door. We're screening them with temperature checks before they can come into the donation center or the site. We also have we've cleaned down the All the cots, we're spacing people in cots further than we typically do to make sure that they can have that social distance. And we have antiseptic and sterilizers available for people. So those are some of the things that we're doing. People can go ahead and check their eligibility in advance by going on the Rapid Pass system on the American Red Cross site and just kind of answer some questions about their background. It makes it a little quicker.
And I can tell you how efficient it is, being over there earlier this morning. The whole process from check-in to donation and getting you all wrapped up was about 40 minutes. A big shout out to all of you and your team out there at the Red Cross, a well-oiled machine. And thank you again to all the San Diegans that continue to come up and support. We need more blood. We need it today, tomorrow, and in the coming weeks. Yeah.
Also had a second question for you, Mayor. We've gotten some phone calls, workers from NASCO and other military contractors, those types of industries, saying that their workplace doesn't have them practicing social distancing or wearing protective gear. Have you heard any of these instances like this? Can the city do anything about this if it is going on? And what can the employees do if they had any complaints?
We'll be working with all businesses, large and small, to continue to reinforce all of the recommendations and all the mandates, particularly when it comes to groups now, in terms of 10 or more. Those continuing evolves that have come from the county to make sure you're practicing all of the things that you need to do, particularly when it comes to protective gear and equipment for those in those specialized industries. So I'll answer the question that says very directly, we're going to be working with everyone to ensure that these recommendations are followed. I can't iterate enough, and a lot of businesses have heeded this. You can have your employees work from home, have them work from home. If you can stay at home, you need to stay at home. You need to practice the social distancing. We will not have the groups gather more than 10. That is ended for all public, obviously, groups. The compliance, we talked about it yesterday from our restaurants and bars has been phenomenal. To see them really springing into action now in terms of food and takeout for those that can, and that San Diegans have responded to that. I'm going to go out and do my part later tonight. And it's helping our economy, and it's helping do the right thing while practicing ensuring that you're following all of those guidelines when it comes to distancing and when it comes to large groups. And again, I can't reiterate it enough. Councilmember Moreno said personal hygiene and hand washing. Stay at home if you can stay at home.
But you haven't heard any of these specific instances?
I have not.
Okay.
Other questions? Not, thank you. That'll conclude today's briefing. I appreciate everybody continuing to get all the work out. And again, thank you to all San Diegans who have been stepping up, helping to volunteer. These are two examples of some real needs that we have right now. Get out there and let's do the best of our city. Thank you very much. Thank you. Thank you. Thank you.